So I am Dr. Nisha Patel, and I am the Director of Obesity Medicine and Metabolic Health within the Transplant Department at California Pacific Medical Center with Sutter Health. What does culinary medicine mean to me? This is such an important question. You know, culinary medicine is at the heart and soul of everything that I do. Food really brings people together, and it's not just about our culture, it's about how we interact with food in our society, it's about how we use food to help our patients improve their health outcomes. And the way I think about culinary medicine really is that it's the how-to of healthy eating. It's the part of the conversation that has been missing when it comes to nutrition educations and interventions in the medical system and our healthcare system. I love helping patients learn amazing techniques to make health-promoting foods tasty and enjoyable. And I often think of it as the culinary literacy intersection with healthcare and nutrition. Culinary medicine has truly changed my life. I have a really wonderful origin story that I should tell, that I learned about culinary medicine first when I actually attended an obesity medicine conference during the pandemic. And there was a registered dietitian there named Olivia Thomas that gave a talk on nutrition for obesity management. And she has this background in culinary medicine. And I remember thinking, she was making me kale salad, and I was like, kale? I really don't like kale. And she started talking about how kale is a distressed leafy green and it needs to be massaged in order to be less distressed and make it more tasteful. And she made her own salad dressing, and I was like, wow, you can make your own salad dressing at home? And mind you, I had just kind of started dabbling with cooking. I grew up not cooking, actually. I mean, we had people in my household that did. And so I just was like, wow, what is this culinary medicine? Because she mentioned it. And then I started Googling and then fell upon the Health Meets Food curriculum and decided to sign up for the certification process. And it truly changed my life. And what's crazy is I actually met Olivia back in January when I was here for another culinary medicine immersion. And it didn't occur to me at the time that it was her. And we were sitting across from each other at dinner. And she started talking about how she works with the organization that I went to the conference, that conference was hosted by. And then I put two and two together, and we put two and two together, I should say. And it was like, oh my gosh, I looked at her and I was like, you changed my life. Because the way I think about health, the way I take care of my patients, there's just this grounded emphasis on culinary medicine and what it means. Food serves so many purposes in somebody's life. It's not just about nourishment. There's so many reasons that people eat, and how can we help them eat better? It's always the how that I think people struggle with, and that was a huge gap that culinary medicine filled for my patients and myself. It transformed my life. It transformed the way I think about food, the way that I prepare food, the way that I talk about food. My son is 18 months old, and I'm just so excited to get him in the kitchen and get him, learning about the different types of foods that we eat. There is no good food, bad food. We eat for different reasons, but how can we really help him and my patients and everyone around me structure their eating where it's enjoyable and easy, right? It has to be easy. So I think that's been just transformative with discovering culinary medicine. Yeah, so culinary medicine has impacted my healthcare team in a really positive way. When I first introduced culinary medicine to our department back in, it's been over 5 years. I remember it was just a Friday afternoon enrichment talk that I gave about culinary medicine, and it was transformative for me again, because some of my colleagues actually texted me afterwards and they were like, you can make a career out of this. And I was like, really? And then the staff also started thinking, more and more about how they viewed food and how they viewed cooking. And the part about culinary medicine that's so beautiful is that it brings such a positive light to eating, because there's a lot of conversations around eating that are very negative. And culinary medicine is about celebrating the joy of health-promoting foods, bringing together all of those positive aspects in our day-to-day when it revolves our eating, our preparing food, and really celebrating those versus, that restrictive mindset of like, oh, I can't have this or I can't have that or I've got to cut this out, right? And so I think just helping people have that understanding and conversation around it has been really, really key. And I hope to continue bringing culinary medicine curriculum to our department, to our patients. I think that there's a lot of interest in this, especially with the food as medicine, recognition more nationally. I think that people are recognizing the benefits of interventions, especially culinary medicine, and how do we translate that to fit all different patient populations? Well, that's the beauty of culinary medicine. There is no one size fits all. And so I'm very excited to continue having those conversations with my staff. Yeah. Do it. Yeah, if a colleague came to me and asked me for advice on whether or not they should pursue culinary medicine, I'd be like, hands down, yes. I actually wear a different hat in my role as well, that I do a lot of clinician and physician well-being work, and we've used culinary medicine and food as a way to talk about and kind of combat physician unwellness or physician burnout. And so it's been really very positively received. And I encourage my colleagues, I'm like, hey, come to the Health Meets Food conference. There's a certification process. When I have patients, or not patients, but colleagues reach out to me on social media, I'm like, hey, here's the website, like you can do this. It is really, I think that's just like a no-brainer in my mind. Like, you should absolutely do it. It'll change the way that you practice. It'll change the way that you think about food. And for me, it's helped me combat burnout. And that's how important it is. I was having some struggles with, well, I should back up and say, I should give some backstory on that. So, I think that we all can recognize the impact of clinician burnout, especially on patient care. Over the last 5 years, many clinicians have left the workforce, which only leaves the system more stressed and our patients not able to access their care. And part of the thing that I struggled with the most, especially when I started out as a hospitalist, is that as important as that work was, and continues to be, and the respect that I have for my colleagues that are doing it, it just wasn't in line with my values of wanting to prevent complications, before they happened, right? Like preventing diabetes before it happened, and preventing heart disease before it happened. And you don't really get a lot of opportunities to do that when you're working in patient medicine. And so I really did have a decision and a leap that I had to make, and it was to found a brand new program that didn't exist before from ground up, not really knowing what was going to become of it. And I'm just so grateful that it's been successful. And a big part of that is culinary medicine. I mean, I really am excited. My team is excited about bringing more culinary medicine to our department, to our patients, to our staff. I do think that it's a very well-rounded way to, address many challenges that people feel, whether it be burnout, whether it be, health problems because they don't know exactly how to translate nutrition education into their life. So I'm just so grateful and hopeful for the future, and this is why conferences like Health Meets Food are incredibly important. I mean, these are my people. I come here and I feel energized, and I feel like I belong, and that's so important. So this isn't, my favorite recipe isn't just like one recipe, it's anything that is a tofu stir fry of any kind. I love tofu now. I did not used to eat tofu, and it was because I didn't know how to prepare it. Mm-hmm. And I learned through culinary medicine different cooking techniques to prepare tofu stir fry. And what's so great about it is that you can use your vegetables on hand, and tofu is a pretty inexpensive plant protein source, and you could use different sauces to flavor it. And so I typically will do different variations. I'll do like an Asian style stir fry, or I'll do like Indian style stir fry. And so there's just so many ways to utilize that one ingredient. So it's not, this is kind of cheating because it's not one recipe, but it is a a pattern of recipes, I should say, that are easy to prepare, versatile, and relatively inexpensive, and health promoting.